Hello and welcome back. I'm Dr. T, a tech trainer and career coach, and I help professionals transition to tech by leveraging their existing skills and abilities. We talk about all things career pivoting on this channel when it relates to tech. We also talk about key tech topics that impact the real world. And this video is me sharing a personal experience. And it might resonate with you, especially if you've ever had a medical test and you wondered, who's really handling my data? I had a routine test scheduled and as a part of my normal annual physical, nothing major, nothing going on. And I got a reminder call the day before the appointment. And the representative asked if I wanted to have AI assisted review of my test results. And I thought, oh, wow, that would be cool. Uh, Great to have another set of eyes on my results, and it may help the greater good in terms of healthcare data and information. But when I asked how my personal information would be protected and managed, that's when things fell apart. The representative couldn't give me a clear answer. Now, let's unpack what that means and why it matters. So, AI assisted review means that algorithms would be used to analyze medical images, lab results, and patient data to detect patterns or flag anomalies. That would be fast, efficient, and yeah, another set of eyes would be looking at it and catch things that maybe human eyes would miss. But the fact that it needs this data and that they couldn't tell me how my sensitive health information would be protected made me say no. I did not want to participate. And it made me think of when I worked for WellPoint, a pharmacy benefits management company. And it was right around the time that the HIPAA rule came out. And all the laws were coming into play in terms of protecting patient data. And my role was to help the teams rewrite the call center scripts so that when patients called in or when the representatives called out to a patient, they would have guardrails around the information that they could share, but that they could disseminate enough details to make the call successful. That didn't happen in my case. And fast forward almost 20 years later, we're coming into AI assisted review. That representative on the call with me just said, wow, I've never been asked that before. And I said, well, it might be your lucky day. I'm a cybersecurity and governance professional, and this is how I see life. So I wanted her to know that because AI would need my data, my name, birthday, medical history, whatever else they were going to feed that system about me, made it a point of concern for me when she couldn't tell me how they were going to protect that data. HIPAA is still the law that protects your health information. And it says that doctors, hospitals, medical providers have to keep your data private. Fast forward to today, now we have AI tools that are becoming involved. And that's where it gets tricky. If they don't remove your name or other personal details before sending your information to the AI system, your privacy could be at risk. And we know some hospitals and medical facilities are already using AI, but they need to learn how to explain it well enough to the patient. And you, as the patient, are given the right to opt out without it compromising your care. If they can't tell you how your information is being protected, then that's a problem. Biometric data is super sensitive. things like your face, your fingerprints, your health details are very sensitive assets. And AI analyzing that is a call for extra protection. So think of it like giving someone access to your phone and your Face ID. You wouldn't want anyone being able to do that. And so the same care should be taken regarding your healthcare data. Is the AI tool from another company? Will my data leave the hospital? Like those would have been the subsequent questions that I would have asked, but she couldn't start out with telling me what protection measures were in place. So, bottom line, if your doctor offers AI help but can't explain how your information stays safe, it's totally fair to ask questions. Your health data is personal and you deserve the right to know who's handling it. So if you're offered AI assisted care, you could ask things like, is my data being de-identified? Meaning all those markers that say, yep, this belongs to me are wiped out and now it's just a data set with information in it that could still benefit the process without identifying you. Who owns the AI tool? You want to know if your provider owns the tool or if a third party owns it, because then another set of protections need to be in place because now there are another set of eyes on your data and another space for uh, hackers or other vulnerabilities to come into play. Is there a data breach protocol in place? They should tell you how you are going to be informed if something does happen to your data. So you want to ask that kind of question. And then you want to be able to opt out without it compromising your care. If I say no to this AI assisted review, how does that impact the care that I'm scheduled to receive? So those are just a quick set of questions that you can ask. All in all, you have the right to informed consent, not just for the type of treatment that you will receive, but also for how your data is being used. AI in healthcare is powerful, but privacy must come first. And if you are a healthcare practitioner, speak up, ask questions, advocate for transparency on behalf of the patient, because health data isn't just numbers, it's a story. If this resonates with you, let us know. Leave us a comment, hit the like button, and of course, subscribe for more details. Let's keep this conversation going. See you in the next one.